I'm here with Commissioner Ellis, Chief Colbreth, our Spring ISD Police Chief, have been a huge leader.
With KHOU 11 News, we are breaking into programming as Harris County Judge Alina Hidalgo ups the county's COVID-19 threat level to severe. Let's listen in.
And Dr. Erica Brown, our Harris County Local Health Authority. First, I want to thank Commissioner, obviously, for being here and for all your support throughout this crisis, making sure that we're prioritizing all communities in every corner of our county. And we have a lot of partnerships going on with Spring ISD, not just on public health, but generally this area. Some of our work on gun violence interruption, some of our work on all kinds of safety and health issues we are working on, in a large part Commissioner Ellis has led that. To Chief Colbreth and Principal Womack, I want to say thank you for welcoming us today and for all the work that you guys have done over the past couple of years to keep the community safe. I wish I were here to report better circumstances, but unfortunately today we find ourselves yet again crossing a threshold we don't want to cross. Because of the Omicron variant, over the past month, we've seen the number of people testing positive for COVID-19 increase exponentially. In other words, we are in the midst of another COVID-19 tsunami. And this time, it truly is a tsunami when it comes to those cases. It's like nothing we've seen before in this pandemic. We've all seen the results of this tsunami of cases firsthand. Teachers, students, parents with the virus. We've seen airlines canceling flights. We've seen businesses having to close earlier because their workers are sick, co-workers out of commission. We all have those stories of people we know. Mercilessly, up until now, this wave had spared us from the sharp increase in hospitalizations that we had seen in the other waves. And that is until now. Because of an increase in the number of folks being hospitalized for COVID-19, today I am raising the county's COVID-19 threat level to level 1, threat level red. It is the highest level. The 14-day average of COVID-positive ICU cases is now 18.1%. The positivity rate is 35%, and the cases continue to climb. This level signifies a severe and uncontrolled level of COVID-19 in our community. It's the third time we've elevated the COVID-19 threat level to red. The first time we went to red, it's because we were in many ways helpless. We didn't have vaccines. But now we're at red, unfortunately, because of a lack of action among those who are refusing to get vaccinated and are ending up in our hospitals. Hopefully, and truly, this could be the last time we go to red. We can make that happen. So I don't want it to all be bad news. So much has changed. As treatments continue to become more available, and they're becoming more available, as more people get vaccinated and boosted, we can make this the last time this happens. But for right now, for the sake of our hospitals and for the sake of our workforce, we have to sound the alarm once again. Not only are the hospital beds being consumed by COVID patients, but the workforce is having to miss work because so many of these health workers have the virus themselves. Even if they're not so sick as to be hospitalized, they have to be home. In a couple of hospitals, I've heard up to 10% of the staff is out with COVID. And so what does this mean for you? What does this mean for the community? The solution to keeping our hospital beds clear for non-COVID patients, for the car accidents, for the pregnant woman that needs to give birth, for the appendicitis case, the stroke, the heart attack, the solution to that is to get the vaccine and get the booster. Do that now so that you help people who may find themselves in need of a hospital bed. The solution to so many workers around our county, including hospital staff, getting ill and missing work, is to take common sense measures to contain the spread of the virus. even if you're vaccinated. Residents experiencing symptoms, COVID-like symptoms, should get tested and avoid contact with others, assuming they have COVID, until they confirm otherwise. Any gatherings should be held outdoors, ideally with masking, as much as is possible. Unvaccinated residents should avoid all gatherings and get vaccinated immediately. You can visit Ready Harris to find a place for a test or to get vaccinated. I want you guys to know Harris County is doing its part to help alleviate the impact from this latest wave. I know parents with students in school in particular are very stressed. Many have been frustrated by a lack of rapid testing availability. So last week we approved an effort with support from Commissioner Ellis and Commissioner Garcia to deliver 110,000 tests to school districts across Harris County. We are also working with CETRAC, our Regional Advisory Committee, to fill gaps, to provide tests. PCR tests continue to be widely available throughout the county, and they're the gold standard. But I know that it takes up to 48 hours or more to get the results back, so that sometimes that can be difficult. But we do have over 10 Harris County public health sites with these PCR tests. So in providing rapid antigen tests to schools, it's another source of information for parents. It helps kids who are contacts of cases be able to return quickly by getting a test quickly, a result quickly, after we know that they're asymptomatic and they've tested negative for the virus. It helps our teachers as well. It simply helps us return to life as usual more and more. Here in Spring ISD, the school district will be receiving 2,250 of the tests we're delivering, and I am so grateful for their participation in this effort. We are also here to announce a new testing site for Harris County. Thanks to the partnership with Spring ISD, starting tomorrow we are opening another testing site at Planet Ford Stadium. It'll be able to accommodate 300 PCR tests each day, and it'll be open for at least the next 2 weeks until a FEMA site opens up also in the same area that will have even more capacity, we hope. Registration for this Planet Ford Stadium will be available starting at 4 p.m. today at readyharris.org. And as I said, it's only one of over 10 Harris County public health sites throughout the county offering thousands of tests every day. I can't be in this beautiful library and not take a moment to thank our teachers, to thank our staff, to thank these incredible frontline workers that have had some of the toughest jobs throughout the pandemic. So I want to acknowledge them and remind everybody that anything we can do to alleviate the stress on these incredible frontline workers and alleviate the stress on our parents, on our families that are facing so many challenges as the kids return from winter break, that we should do this. And I want to thank Spring ISD again for their leadership since day one. They have been following the public health guidelines. They were some of the very first ones out there with masking, and that has shown in the results they've had, and really bringing the community together. As with the start of the virus, it's a community issue, and it's an issue that we solve together as community. And I hope that all of us can continue to work together to make it through. I'll repeat very briefly in Spanish. Le quería agradecer a la directora Womack de aquí de la primaria, Booker, también al jefe de policía, Ken Colbreth, y al comisionado Ellis. Me gustaría estar aquí para reportar mejores circunstancias, pero desafortunadamente estamos cruzando nuevamente un umbral que no nos gusta cruzar. La variante Omicron del COVID-19 ha realmente explotado en esta comunidad como lo ha hecho en muchas otras comunidades. Estamos viendo esencialmente un tsunami de casos que ha impactado a todo el condado. Hemos visto el impacto, vuelos cancelados, negocios sin trabajadores, trabajadores en nuestros propios sitios de trabajo que no han podido continuar con su desempeño por causa del virus. Hasta ahora, sin embargo, hemos evitado lo peor de este tsunami con limitadas hospitalizaciones por la ola de Omicron. Lastimosamente, ya entramos nuevamente a un incremento en hospitalizaciones. Dado a un incremento de personas hospitalizadas por COVID-19, hoy estoy elevando el nivel de amenaza de COVID-19 del condado Harris al nivel 1, nivel rojo. La tasa de positividad está a 35%, la población en las UCIs que tiene COVID-19 está sobre el 18%. Este nivel rojo significa un nivel descontrolado de transmisión de COVID-19, un nivel severo de transmisión de COVID-19. Es la tercera vez que hemos elevado nuestro sistema al nivel rojo. La primera vez que fuimos a rojo, en algún sentido, pues estábamos indefensos, no teníamos vacunas, no habían tratamientos. Hoy día es diferente. Está en nuestras manos el que esta sea la última vez que vamos al nivel rojo, porque ya hay vacunas. Pero estamos lastimosamente nuevamente en rojo por aquellas personas que se rehúsan y se niegan a recibir la vacuna. Espero que esta sea la última vez, con tratamientos que se están volviendo más y más accesibles, con personas más y más vacunándose y poniéndose el refuerzo, pero nuevamente se están consumiendo nuestras camas hospitalarias por casos de COVID y eso está impactando a la comunidad en general. Además, no solo son las camas hospitalarias, hay también trabajadores de hospital que no están pudiendo trabajar porque tienen el virus. Hay ciertos hospitales donde hasta el 10% de los trabajadores hospitalarios están fuera con COVID. ¿Qué significa para ustedes? La solución para mantener el número de camas hospitalarias abiertas, para los derrames, para las mujeres dando a luz, para los accidentes de carro, es que se vacunen y que se pongan el refuerzo. La manera de controlar tantas personas con este virus que están enfermas y no pueden trabajar son medidas de sentido común, utilizar la mascarilla, hacerse la prueba. Estas son las recomendaciones. Si tiene síntomas de COVID-19, hágase la prueba y evite el contacto con otros, asuma que tiene el virus hasta que sepa lo contrario. Cualquier reunión, hasta donde sea posible, de llevarse a cabo afuera y ojalá con mascarillas. Personas sin vacuna deben evitar cualquier reunión y vacunarse inmediatamente. Puede visitar readyharris.org para hacerse una prueba o para recibir su vacuna. Estamos poniendo de nuestra parte también para aliviar esta última ola de casos. Específicamente, hemos aprobado la compra de 110,000 pruebas rápidas para distribuir a nuestras escuelas. Hoy día le estamos distribuyendo 2,250 pruebas a esta primaria Booker para que puedan así los niños regresar a estudiar, los niños que no tienen síntomas pero que han estado en contacto con otro niño con COVID. Seguimos teniendo las pruebas PCR en las sedes de vacunación, en las sedes de prueba del condado Harris y hay más de 10 sedes de prueba, pero pues yo sé que estas tardan 48 horas. También vamos a anunciar una nueva sede de prueba para el condado Harris. Empezando el día de mañana, abrimos una sede en el Planet Ford, en el estadio Planet Ford, aquí en Spring. Se pueden empezar a registrar hoy día a las 4 de la tarde. Y tenemos más de 10 sedes, miles de pruebas diarias PCR a las cuales se puede registrar en readyharris.org. Quiero agradecerle a los maestros, estando aquí en esta escuela tan hermosa. Quiero agradecerle a todos los trabajadores escolares por el sacrificio que han hecho. Y sé que ahora que regresan los chicos a la escuela es muchísima la ansiedad, el estrés que tienen los padres con tantos niños enfermándose. Entonces, ayudémonos los unos a los otros, poniéndonos las pruebas, poniendo las vacunas, haciendo las pruebas, utilizando la mascarilla. Ya esto va para mejor, pero hoy día la situación está difícil nuevamente. Y eso, el controlar eso está, como ya sabemos, en nuestras manos. We'll hear from Commissioner Ellis and then from the chief.
That was Harris County Judge Lina Hidalgo saying that because we are in the midst of a COVID-19 tsunami, Harris County's COVID-19 threat level has been increased to red, which is the highest level. This is because hospitalizations continue to rise. Judge Hidalgo says the 14-day average is now at 18.1%. The COVID-19 test positivity rate in Harris County is at about 35%. For residents, this means you are asked to stay home unless you're fully vaccinated. You're asked to avoid gatherings inside, to mask up, and to get vaccinated or get boosted. She also announced a new testing site at Planet Ford Stadium. They will have 300 PCR tests there a day. This opens tomorrow. It will be open for at least 2 weeks. You can sign up for these tests, though, starting today at 4. In addition, Judge Hidalgo also says they will provide 110,000 free rapid tests to school districts all around the county. We have more details on KHOU.com, and of course, we'll have much more on this at 4 on the 411. We'll see.
Hot and cold.
I would get hot and cold, yeah.
Get rid of hot and cold.
3.
So you're going to get rid of hot and cold. Tiffany, what's behind curtain number 3, hot and cold?
It was new kitchen appliances.
Oh, okay.
County, and in some ways, I can't help but think that this pandemic plays a role in that as well. So, Judge, thank you for your leadership. And with that, I neglected to mention that Erica Brown, I hadn't seen her in person when she had the mask on. I've only seen her on Zoom. It's good to be with you, of course. And with that, I bring up Chief Ken Colbert.
Hey, Mr. Harris, thank you. Chief Ken Colbert, as also the representative of the district today, and as our leader of our emergency management team, I want to say first thank you, Judge Hidalgo, for your leadership, Commissioner Ellis, and our partnership we've had with Harris County since the beginning of the pandemic. It's also my pleasure today to take an opportunity to say that we will take these 2,000 kids, we will put them into our schools to try and support our families as best as possible. We're continuing to work through that process, and tomorrow, Judge mentioned that we have a site that's opening up with another partnership, extended partnership with Harris County at Planet Ford. So just another opportunity for us to support our campuses and our community. Since the beginning of the pandemic, we've also partnered with another private vendor who we also have at 2 other sites. So we will continue those partnerships and do everything we can to continue to provide a service to our kids to keep them in school learning. In addition to these measures that we're putting in place, we're also asking that our staff and students continue to practice the processes that we have in place and the procedures of masking, of keeping the hygiene levels to the levels that we currently have them, and following all protocols. If you're sick, please stay home. And these tests give us another opportunity and another tool that if you feel ill or you were exposed in close contact, you have another tool to make sure that you're starting the process to go get a PCR test. And again, I want to thank Commissioner, also Harris County, thank you so much. You and I have been on several calls together, and your leadership has been paramount to this movement as well. And Judge Hidalgo, thank you.
Thank you. Thank you so much. We'll take questions.
Jack, what's your view on the events coming up, obviously, with the marathon this weekend, MLK parade, and the rodeo in a couple weeks?
Yeah, we're taking it as it goes. The situation right now is very, very volatile. We need to see where the cases will go. We need to see where the hospitalizations will go. As far as the marathon, I know that Dr. Peirce personally signed off on the marathon plans. He's the local health authority for the Houston Health Department, and so I had the Harris County Public Health Department consult with them and confirm that the Houston Health Department had signed off on it. What I'm told is that the marathon is implementing several measures for phased starts, keeping people out of indoor settings, not passing out food in the same way in indoor settings, etc. As far as the rodeo, it is something that it's hard for me to speak on right now, knowing that it is still well over a month away, the start of the rodeo. And so we'll see if by then the cases, and especially the hospitalizations, are trending down. I hope so, because if there's one thing that I hope we can celebrate as before, it's the rodeos where it all started. So that's another impetus for us to all do our part. The guiding principle here is there's a big difference between indoor events and outdoor events. Events where there's mass outdoors, even better. So to the extent that that can happen, and that people who go are vaccinated, that's the kind of thing that at this stage, with the vaccine being available, that we can feel more comfortable with.
Judge, at this point, the growth rate of Harris County's vaccination rate is very slow, to the point that at this rate we wouldn't get to 70% until about July. What, if anything, can Harris County do to boost that rate, and why do you think it's so slow at this point?
We've done everything we can, right? From sending more vaccination sites to areas with lower vaccination rates at the start, prioritizing the areas that most need the vaccinations because they're harder for them to access it, partnering with community groups that have the ear of the community to try to get people there. We did our incentive program. We've partnered with schools on several different initiatives. So, you know, the one other thing that we could come up with, unfortunately, became politicized and fell apart. So, you know, that was the other thing that we had come up with. I'm constantly challenging my public health team to come up with something new. And the truth of the matter is, we've tried it all except for, you know, this other thing. So I need to appeal to the community. The most powerful messenger is you. If you know somebody who doesn't have the vaccine, if it's a friend, if it's a colleague, if it's a family member, if you tell them that you got it, you're just fine, still standing, you're feeling healthier, that will go a long way. That will help a lot. A lot of, or whatever polling data exists says that it's a person-to-person message. And look, we're going to continue partnering with the schools. That's where we have the lowest vaccination rate, is particularly on the kids. And so we're going to keep working on that and doing everything we can come up with. But that's why we're here. Those folks taking up the hospital beds, they are the folks who are not vaccinated. And of course, there are some folks there as well who are immunocompromised. But a big portion of it is the folks who simply are refusing to get the vaccine. So this is another reminder. We're not giving up. That's why we're here today, and we continue with our efforts. But there's only so much that we can do. We've tried it all.
Josh, can you speak to, the mayor spoke a little bit about how many city employees, firefighters, police officers are out. He mentioned that they might not be able to get to as many, like a trash pickup in the city for the same day schedule and things like that. Are you aware of how something similar, do you have similar stats for the county, or do you know of any services that might be impacted or slowed because of so many county workers being out?
I can't give you specific statistics as to what percentage of folks are out, but I will say we have a lot of people out. I'll say in my own staff there are people who are out, and the reminder there is, you know, the mask. The mask makes a big difference. If you have to go to work, and only having the people in person who really need to be in person. And so we've done that at the county. As we move to threat level red, we again pull back on the staff that has to go and be there in person. So it is obviously causing an impact, as it is throughout the rest of our society.
Judge, you mentioned last week that around 900 or so hospital workers will be coming to the region to help out with the hospitalization situation. Do you have any more information on that, where they're coming from, what hospitals will be going to, and when we can expect to see them?
Those are hospital workers from the state. I believe some of them have arrived. I'll let Dr. Brown speak to it if she has more details. And we're looking at additional hospital staff. Unfortunately, that was only the beginning of the strain in our hospitals. So that the state sent those workers, and Harris County, we are having to work on even more, because we're receiving requests from the hospitals right now that they simply do not have enough staff to deal with this. And so we're going to have to ask for even more healthcare workers. Do you have specific numbers, Dr. Brown, as to how many have arrived already?
So you are correct, Judge. That So 900 have arrived from the state, and we are working on another 600 coming from other states across the country. That's how much help we need, but understanding as well, other states need just as much help. So we're working to get that done within this week. I don't have specifics.
And Judge, what were the initial stats you repeated really early on in your remarks that led into the rate level again?
The last indicator to go from orange to red was the percentage of the ICU population that is made up of COVID positive patients. And so that number has crossed 15%. That was the threshold. It is now at 18.1%. And I also noted the positivity rate is through the roof. I mean, the cases per 100,000, we're having to redo the chart every week because it just doesn't fit in there. But the good news there is that that's sort of decoupling from hospitalizations. Now the positivity rate is 35%, extremely high. And, you know, in some ways, if we get to a point where we can live with this virus, okay, people get it, they recover. The problem is when you're having this impact on our hospitals that we're already seeing, as well as so many people being out to where, you know, so many parts of our society are having to suffer.
Does it frustrate you, Judge, that we can talk like this or have these talks like this, and there's just going to be a significant number of people who don't care?
You know, I think that there is unfortunately some apathy, and I can't blame the community for that when there's so much mixed messaging. I mean, to the point that a disaster becomes politicized, to the point that disaster response becomes politicized. Of course, some people are going to throw their hands up in the air or, you know, may even buy into some of this stuff. So I don't blame it on the community. I think my role is to continue to be very consistent in the messaging, and I'm unwavering in the plea for folks to get the vaccine in order to do their part to help our community. I think that to the extent all folks in positions of leadership and with a platform to reach different communities, to the extent that they can echo those words, that will help persuade people as well. And I'm hopeful, I'm hopeful that as time goes by, that we will see enough of an increase in vaccines and enough of an increase in the availability of treatments that we'll be able to stop having these kinds of news conferences. Lo que significa hoy día en el color rojo es más que nada una alarma que suena, que quiero que la comunidad escuche, que necesitamos que la comunidad escuche. Significa que si no se ha puesto la vacuna es el momento de hacerlo, porque si no lo hace, son las personas que no se han vacunado que están yendo a parar en los hospitales y la razón por la cual estamos aquí. Si no se vacuna la población, ahora en nivel rojo, regresamos a la situación en la cual le tenemos que negar atención a personas enfermas, porque no hay suficiente espacio en los hospitales. Lo otro que significa es que deben tomar medidas razonables de sentido común, utilizar la mascarilla, hacer las reuniones afuera, porque si seguimos con este esparcimiento, esta transmisión de casos tan grande, vamos a seguir teniendo problemas en cuanto a ausencias de trabajadores a través de la economía. Entonces, es de cierta manera el pedir atención de la comunidad, decir atención, alerta roja, las vacunas, la mascarilla, las reuniones afuera, para poder abordar esta situación. Y ya entre más se vacune la gente, espero que esta sea la última rueda de prensa del nivel rojo.
¿Cree que eso sí lo va a bajar los casos? Porque no han hecho caso a esas medidas. ¿Cree que esta vez, por qué lo tendrían que hacer caso? En todo caso, ¿por qué
la verdad, para mí la culpa del hacer caso o no hacer caso no es tanto de la comunidad, sino tantos líderes que han convertido esta pandemia en un tema político. Cuando uno es un residente, tiene su trabajo, su familia, está ocupado y escucha que un líder que dice que el COVID sí existe, que no existe, que sí la vacuna sí es segura, que si no, bueno, es fácil simplemente decir, ok, olvídelo, ni me hable del virus, yo vivo mi vida. Entonces yo entiendo un poco el desespero, entiendo un poco la apatía. Entonces lo que estoy intentando hacer y entender es que el hecho de que haya cierta confusión, de que la pandemia se ha convertido en un tema político, no significa que yo no vaya a decirle a la comunidad el mensaje necesario. Lo que nos podría ayudar es si más líderes y más personas que tienen pues la oportunidad de hablarle a grupos grandes de personas, dicen las cosas como son y también dan ese mismo mensaje de por favor vacunarse, de por favor utilizar la mascarilla y tratar de hacer las reuniones por fuera. Eso es lo que yo más puedo hacer. No me voy a dar por vencida, no nos estamos dando por vencidos. Cada persona que se vacune es ganancia. Y cada persona que me está escuchando, si usted ya se ha vacunado, ya se ha puesto el refuerzo, utiliza la mascarilla religiosamente, hable con alguien más en su familia, hable con un amigo, hable con un colega. De repente es un poco incómodo, pero eso puede tener un gran impacto, el usted demostrarle que se vacunó, está bien y nada pasó. Y pues la gran mayoría de la comunidad se ha vacunado, entonces seguiremos en la lucha. Para mí hay causa para ser optimistas, porque vienen más tratamientos, porque más gente se vacuna y espero que tomemos conciencia con cada día que pasa. Yo aquí seguiré haciendo todo lo posible para compartir ese mensaje y lanzar iniciativas como la de hoy, pruebas rápidas para las escuelas, para que los niños puedan regresar rápidamente a estudiar. Seguiremos haciendo ese tipo de cosas. La recomendación para las personas no vacunadas es que eviten cualquier tipo de reunión. Entonces, sí, si van a estar en el trabajo con un grupo de gente, pues la recomendación es que queden en casa. Las personas que tienen la vacuna, simplemente que utilicen la mascarilla y intenten, si es una reunión grande, hacerla afuera. We were able to get our hands on 50,000 test kits, 55,000 test kits. Each test kit has 2 rapid tests. So it's 110,000 rapid tests for our county. What we decided to do is to give each school district that needs them the number of tests equivalent to 5% of their staff and student population. And, you know, in some school districts, around over 15% of their staff and student population right now either has COVID or has been in contact with somebody who has COVID. So, you know, but in some school districts like this one, the number is much lower. So that's why we landed at 5 and also given the supply of tests. We've given the school districts guideline as to how to distribute these tests. So we say distribute it to students who have come into contact with somebody who has COVID, ideally who are not symptomatic. Kids who end up being symptomatic but come back negative, we ask that they go get a PCR test just to make sure they're actually negative and it's not a false negative. And we're trying to get our hands on additional tests. Just this morning before I came here, we found some more. So we're trying to see if we can snatch them up. And we're gonna continue looking out for those tests. As far as which school district we send them to, HISD and Katy ISD had their own testing programs already, and so I don't believe we sent them, right, Dr. Brown? We did not send them tests because they had it already set up. But the other school districts, we offered the program to all of them, and most of them, if not all of them, have taken us up on it. I'll give Dr. Brown a chance to add any other information. Yeah.
Thank you, Judge. I don't have anything additional other than to say again, it is very, very important that if we have someone who is symptomatic or we have children who have come in contact with someone who has tested positive for COVID, that we go ahead and use the resources that are currently available.
FEMA site will open in this area in a couple of weeks. Do you know where that'll be? If you can provide more details.
I don't have any more details. We're waiting to hear from the federal government, but as soon as we know with certainty the timing and the location and the scale of it, we'll let the community know. Great, thank you so much. Thank you guys so much. Yeah, thank you for coming.
Commissioner, I'm going to call